This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Allyson Ocean, Associate Professor of Medicine at the Weill Medical College of Cornell University and Medical Oncologist at the Jay Monahan Center for Gastrointestinal Health in New York City. Hello, Dr. Ocean.
Thank you for having me.
In addition to surgery, what are the modalities that you use and compounds that are out there to treat?
The only curative modality for the treatment of pancreatic cancer is surgery. So we try to do everything we can to get people to have this Whipple operation for the surgery. About 85% of people cannot have the surgery. So only 15 to 20% of people are ever able to have the surgery. So if you can't do the surgery and these people are considered to be locally advanced or unresectable, at that point we do treatments with chemotherapy and or radiation to shrink the tumors down, sometimes to get it to surgery, but rarely, and then also to stabilize the disease and hopefully improve survival.
Are there targeted therapies available to treat pancreatic cancer?
The only targeted therapy that has been FDA approved that's been shown to improve survival in advanced patients is erlotinib when added to gemcitabine. And erlotinib is an EGFR inhibitor. It's a small molecule, it's a pill. It's given once a day for patients, and it has been shown to increase survival. But those advancements are modest. I mean, we still have so much more work to do. There have been many, many trials looking at different pathways to inhibit the growth of pancreatic cancer. And many of these trials have been promising early on, but then when they pan out, they're not so promising. We're looking at other pathways such as the hedgehog inhibitor pathway, the angiogenesis pathway. The research focus now for pancreatic cancer is going into things like oncolytic viruses, like getting viruses in there to kill the cancer cells. Gene therapy, vaccines, all of this stuff is ongoing in research now to try to get to this tumor that's very, very hard to treat. You asked the question, well, why is it so hard to treat? It's so hard to treat because the therapies that are available now just don't get into the cells. There's a large fibrotic scar tissue like component around the actual cancer that serves as a barrier for agents to get in. And radiation doesn't break it down, the chemo doesn't break it down. We're researching agents that will get in there better, and that's really the crux of the research nowadays.
Thank you, Dr. Ocean. Dr. Allyson Ocean, Associate Professor of Medicine at the Weill Medical College of Cornell University and Medical Oncologist at the Jay Monahan Center for Gastrointestinal Health in New York City.
Thank you.
Nice to see you again.
Nice to see you too.